Good day. My name is Aldrien L and today we will be performing the oral care procedure. So let's begin with doing the medical hand washing. And then prepare the materials needed in the procedure. Next is to introduce ourselves to the patients and verify the patient's name and explain the procedure. So good day, sir. My name is Aldrien Jadraque. I'm a student nurse, and may I ask, sir, your name is
Jadraque. Yes,
Okay.
sir.
So the procedure will be oral care. This is to help promote oral hygiene. Okay. Are you okay with the procedure, sir?
Yes, sir.
Next is to provide privacy for the patients. And then begin with doing the medical hand washing. And done gloving. So next is we need to position the patient in a high Fowler's position. Next thing we do is to drape the patient. And then we'll be offering the mirror and the dental floss. Sir, sir, ang dental floss around there, sir. Pwede na po nakaasa ko mo, sir. And if the patient has done flossing, we will be giving the waste receptacle. Sir, dali lang, sir. Next is to give the patient a cup of water. Sir, dali lang, sir. Let the patient gargle and we'll be offering the kidney basin. Sir, dala ka, sir. Dali lang, sir. Next thing is we need to offer a tissue to the patient. Sir, wala tissue. And also offer a waste receptacle. Next is we will gonna be giving the 20 ml mouthwash. Sir, let the patient gargle for a minute and then we will ask the patient if he's done gargling. Sir, no, wala ba, sir? Next is we'll be offering the toothbrush with a toothpaste on it. And then the patient will Brush his or her teeth in a 45-degree angle, starting from the top to the bottom to the sides and to the top. If the patient has done toothbrushing, we'll be offering a tissue. And then we will wrap it. Next is we'll be offering a cup of water. And if it's done gargling the water, we'll be offering the kidney basin. And then we'll be offering a tissue to the patient. And with also the waste receptacle. And now we'll be offering a lip moisturizer together with a mirror to the patient. And then let them apply it. And then we'll be getting the bath towel. And now we'll be positioning back the patient to the supine position. And then we'll be finally removing our gloves. Do medical hand washing, and after that, do the aftercare and proceed with the documentation.
Proceed to the second procedure, which is the bed bath. First, check the doctor's order, and then do your medical hand washing. This is an improvised way of doing it using the alcohol. Next is to prepare the materials needed and go to your patient's room and ask if it's the right patient. Check the wristband and make sure to get the consent. Then do your medical hand washing again. After, don on your clean gloves. Make sure to follow the principle skin to skin and glove to glove. If you're done fixing your gloves and making sure it fits well in your hands, throw your paper lining you used in your clean gloves. And then ask for toileting needs. For males, use a urinal. If females, offer a bedpan. And then remove your gloves. And then we provide privacy to ensure that our client's dignity is protected. And then we check the temperature of the water, and we do our medical hand washing again. And we don on our second clean gloves. Just follow the principle I stated earlier: glove to glove and skin to skin. If you're done with your donning of your clean gloves, put it in a waste receptacle, and we proceed to the bath blanket. Place it in the center and drape the patient. Make sure to let the patient hold the tip, and then you're gonna get the top sheet and pull it down. And after, raise the blanket and let the patient remove his or her clothes. And then automatically after this, we get the patient's clothes and we put it down. We ensure that this is safe. And then let's proceed to the actual procedure. We apply the first bath towel in the chest area of the patient. Make sure to let him hold the tip, and then we pull it down into the center. And then we get our small towels and make a mitten. And we wrap it in our hands. During this time, there was a water outage, but for reference, Aldrien will do the cleansing and I will do the rinsing. And then we start by soaking our hand towel with soap solution and start from the inner counters to the outer counters using the face towel. And then after, your partner will rinse it. And then next, change the hand towel and then go to the forehead, going down in an S motion. We use the index in the upper nose and pinky in the lower nose. And then we rinse. And then next, the ears and the neck. We wipe the inner ear using our index finger and wipe the external ear using the pinky finger. And we rinse in the same direction. So we're done with eyes, forehead, and chin, ears, and neck. And let's proceed to the arms. First thing that we're gonna do is to put the arm out and then cover it for a while. And then we get the hand towels and form a mitten. And then the same goes to the eyes, to the neck. We soak it with the soap solution. We have a 4 strokes. And we rinse in the same direction. and then cover once again. And then get your next hand towel and then put it under the patient's hand and cover it for a second. And then get your basin, then soak the hand, then wipe the hand. Wipe the hand from the palm, dorsal, interfingers, intercostals, and fingertips. And then drop your hand towel and cover and wipe and let it dry for a minute. So the next landmark is the chest. We get our hand towels and we let our partner hold the bath towel, and then we use and we incorporate the 5 strokes. But if your patient is a female, we include under the breast. And then we rinse in the same motion and let it dry and cover. And next, we go to the lower abdomen and upper thigh. We apply the second towel to the lower abdomen. In safety purposes, we just show you the landmark and how we apply the strokes in the chest and in the lower abdomen. This is equivalent to 5 strokes. After is we proceed by pulling off back the bath towel and rolling the second towel that we used and discard it in the hamper. And next, my partner will get the first towel and roll while I'm fixing the bath towel. And let's proceed to the legs. We move our bath blanket up and we make sure that we separate the legs and make a donut. And then we get our third bath towel and make sure the legs are flexed so that we can be able to put correctly our bath towel. And then we cover it up. We get our hand towel. We make a mitten. And then we proceed right away with the cleaning. First is a soap solution. We use the 4 strokes. And then after, we get our rinsing solution, which is the water. And we wipe again. 4 strokes. And then we cover and let it dry. So next, raise your legs and then get a hand towel and put it under the feet. Then cover for a bit and then put the soap solution on the towel. Then soak the feet and wipe. After wiping every part of your feet, get the kidney basin, remove the hand towel, and place it in the hamper. And then remove the bath towel too, and untie the bath blanket. And then roll that up. and put it in the hamper. So next, let's proceed to the upper back. We instruct our patient to roll, and then we apply the bath towel and then put down the bath blanket to the abdomen and let the patient hold still. And then we roll it up so that we can have a better viewing of the back. And then we do the same manner. We put in our hand towel soap with soap solution and wipe 5 strokes that is away from us. And then in the same direction, we rinse it. After rinsing it, put down the bath towel and then let it dry. And then next, get it back and we put our lotion. And then we do our therapeutic massage. In this case, we use Florage. And after our therapeutic massage, we put it back the bath towel and we move into the lower back and put another towel. Then we lower the bath blanket until the thighs. In the same manner, we expose the area where we cleanse and rinse so that we can have a better viewing. We get our hand towel and form a mitten. And then we wipe 5 strokes. And after, in the same manner, we rinse in 5 strokes. After we pat dry, we bring back the bath blanket and we remove the towels and put it in the hamper. After, we position back the patient. And then we ask the patient's hand, then wrap the soap-soaked face towel around it. And then we let the patient wipe his genitals. After, we offer a plastic for the soiled towel. And then we put again a hand towel and form a mitten for the rinsing part. And after rinsing, we offer a plastic for the soiled towel. And then we move the top sheet back. Next is we remove the bath blanket and we place it in the hamper. And then we give the clothes of the patient and we do tenting. After which, we remove our gloves, we do medical hand washing, and we do aftercare of all the materials that we used. This procedure was quite long, but this will promote hygiene and help the patient in his total healing. And after, we do documentation so that we can assess if the procedure was successful. Thank you.